Hello, everyone. Whew, it's been a while, and I'm ready to be back on here with my Finding My Voice series, Healing Beyond Adoption. And as many of you know, it's been really tough. It's been very hard for me, and I've been working very hard to um, find stability again. Um, I got to cry a little bit earlier, so hopefully I'll be able to get through this without crying. But bear with me because it's been extremely difficult. Today's Sunday, and I have a really tough week ahead of me because I was taking this medication and I'm gonna stop taking it completely because I need to be able to function and do things. Yeah, and it's preventing me from being able to function. So um, I'm just gonna stop it. Have you ever seen somebody that has been through hell? I am not afraid to be transparent about my health challenges because I have been through hell with the amount of pain I've experienced over the years. This week, I am determined to find my voice because living with chronic pain doesn't mean giving up my autonomy. Absolutely not. No. I had an appointment this past Tuesday with an orthopedic doctor, and I made a huge mistake because I have not had good experiences with orthopedic doctors in the past. I'm even sure that I made a mental note to be certain to record future conversations with doctors, but I completely forgot last time. It's been a lot. I've been dealing with a lot, and so I forgot. Anyway, the reason why I wanted to record is to prevent she said, he said. Um, Again, I have had bad experiences with orthopedic doctors, and I guess it shouldn't have been a shock to me that I had a horrible experience again. And it would have been really nice to be able to talk, raise my voice, and not have it be she said, he said. To have had proof and backup that my frustrations are valid. So what happened? Um, I deal with various different health issues. I live with chronic pain, and One night, I had severe chest pain. I ended up in the emergency room, and the doctor told me that the only reason they could find that could explain my chest pain was that I had a curvature in my spine. And what he actually said when he walked into the room was, "Has anybody ever told you that you have scoliosis?" I had never been told that before, despite having had x rays many times in the past. That was the first time I was hearing it. Anyway, um, at the time, I had a severe pinched nerve also. Um, so that kind of explained a lot of the chronic pain that I had been dealing with. Um, Throughout that time, I went through to many doctors, many specialists, trying to find a cure for the severe pain that I would experience. Um, for part of that period, I was in California, and it was very tough. It was extremely hard. Sometimes my pain would be so bad. Um, I don't know how to put this, that I lived next to the Coronado Bridge, and I would think about it. And I remember one particular night, I was just thinking, you know what, I just want to go to the Coronado Bridge. But the one thing that would give me some relief was going to the gym. So I would go to the gym, whether it was 3 in the morning, 4 in the morning, 5 a.m. Um, Daytime, I would go to the gym multiple times because that's the only thing that would give me some temporary relief. Um, it was hard. I suffered a lot. So if you have scoliosis, I guess mine is labeled as mild scoliosis. Good luck trying to find someone to take you seriously. Good luck. There are a few good doctors out there, but overall, I've dealt with many people that dismiss me, dismiss my suffering, dismiss my pain. It is very tough. As I mentioned, I saw a lot of specialists, many different doctors, but it took a really long time to find a specialist that was able to help me untrap the nerve. The pain was just as bad. That is, the pain to untrap the nerve was just as bad as the day it happened to me. But through physical therapy, um, working hard at the gym, I was able to regain my strength. And today I feel much better. I am not back to 100% as to prior get to getting the pinched nerve, but I have no complaints. Um, my thoughts keep escaping me, but yes, going back to thinking of the Coronado Bridge, despite my severe pain, and I had pain day and night, even in my sleep, I would tell myself, I cannot die like this. There's no way I can die while I am in this much pain. I told myself that I had to survive this chronic pain. And I knew that if I survived the pinched nerve, that I can survive anything. Yes. So there's no way for me to talk about anything without the mention of the fact that I am an adoptee. So it's not a surprise that I survived my adoptive sister throwing all of my things away, or I should say majority of my things away, because they still have a lot of my belongings. They kept them. It's no surprise that I am sitting in front of you, and that despite the fact that I truly value stability, that I truly value having things in order, having a stable place, that I didn't lose my mind, I didn't lose my life, and that I'm still sitting in front of you, that I survived all the rotten things that my adoptive family have done to me, all the curses that people want to cast my way. I am able to dodge them and still be here. So, going back to my doctor's visit, one of the things that the doctor asked me was, how do you know that you had a pinched nerve? I gotta find my laughter for you. Give me a second. What? What kind of a question is that? How do you know that you had a pinched nerve? I'm not gonna say anything to that. Anybody who has had a pinched nerve in their life, especially along their spine, I'm gonna repeat that, especially along their spine, you can have at it in the comment section. I'll be happy to read and see what you all have to say. Seriously. I feel like I need to laugh again. Mm. Yeah, so I've had doctors who listened, explained their reasoning, answered questions, respected my concerns, which I think is huge. This is a two-way relationship. If a doctor doesn't respect your concerns, that is a huge red flag. And I am at an age, don't be fooled by this. I am at an age where I should know the difference between someone that I can trust and someone that I cannot trust. Having a doctor that respects your concerns is huge. And patients should be treated as a partner in their care, period. I live in my body 24/7. And at the end of the day, I hold the ability to have the last say and to accept whether I go through with a treatment or not. Then, yeah, of course, I experience doctors who dismiss me and who act like my input is not important. And the difference is huge and it matters. So now I'm having doubts. And mind you, it's not like I'm expecting the doctor to agree with everything I say. No. But at the same time, I think that there should be a level of professionalism from the doctor. And I did not get that from this last appointment. Um, I did not feel like the doctor respected my concerns at all. I have symptoms. I experience chronic pain, and there were certain things that were said that I don't agree with, as well as the demeanor of the doctor. I understand that people express themselves with facial expressions, um, but I know that the facial expressions I was getting from him meant that is ridiculous, that is impossible. And this is what I got from my adoptive mother for many years. I used to explain to her that I had pain and she never took me seriously. She never took me to get evaluated. And because of that, I went on to suffer for many years. Um, and I have a lot of resentment regarding that because if I had known that I had scoliosis, I would have done things very differently. Even the times when I went to the gym for relief, I would have exercised differently, but I didn't know. Anyway, I do want to go into some detail about what my experience with the doctor was like. So, of course, he asked about my medical history, and I tried to explain to him that I have scoliosis. And not only do I have scoliosis, I also have cervical spina bifida. I brought my x ray with me from 2023. I also brought my MRI from 2023. Sorry, I think I have a pinched nerve that's radiating pain to my head. Anyway, what was I saying? Yes, so as far as the cervical spina bifida, I got diagnosed in 2023, the beginning of 2023, around April or so. And the reason why I got the diagnosis was because I was having severe pain along my neck region. All these muscles were very weak. Um, I lost my voice. And so I had a doctor's evaluation, and he said, "You need to get an x ray." So I went for the x ray, and they told me, "You have cervical spina bifida." Now, I explained this to him, and he tells me none of the structural problems I have explain the chronic pain that I experience. Maybe I need to unleash my laughter again. What? This orthopedic doctor told me none of these none of these structural problems that you have explain your chronic pain. Despite the fact that I brought an x-ray with me and an MRI report, not only did he claim that these structural problems are not responsible for my chronic pain, he stated that, hold on, I'm losing my thought here. He stated that, oh my gosh, this was important. Um, I will remember. Yeah, it's tough. I had an alarm go off, so I got disconnected. I am on iMovie. I wish it had a pause instead of a stop, because every time it stops, I have to reset again. But I really need a pencil so that I can jot my ideas down so I don't forget. Anyway, so um, my question is, wouldn't it be a bit obvious that my structural issues do contribute to my chronic pain? Because I was having neck pain, everything was hurting, I was losing my voice. Then I got an x ray and they diagnosed me with cervical spina bifida. And then he tells me, "Your structural problems do not explain your chronic pain." Please help me understand that. I just don't get it. Another issue that I deal with is muscle spasm. Um, I had a treatment for that. I had an epidural. I explained that to him as part of my history, and he said, "Why did they do that? I don't think that was necessary." Okay. You don't think that was necessary? That was 2023. We are in 2026 now. Mind you, this was for a different issue. The epidural was for muscle spasm, and the issue that I need to be resolved is neck pain as well as lumbar pain. And he's telling me it wasn't necessary. Well, you were not there in 2023, and I told him the treatment worked. I was in severe pain and I experienced a lot of relief from the treatment up till today. I can not imagine if I had to deal with that much pain into 2026. So what the doctor did was good. And I love it when I go to a doctor, they I tell them what my problem is and they do a treatment and it works. This is what the patients want. And he tells me, I don't think that was necessary. Yeah, um, going back to being in California and being in severe pain, after my nerve got untrapped, I was still working hard at the gym because my muscles were very weak in my thoracic spine, um, and needed strengthening. But I was still experiencing some pain and discomfort, but it was different than what I was feeling before. So I decided to consult a doctor because I had suffered so much. I just wanted everything to stop. Anyway, so I went to a doctor and I told him about the severe pain I had experienced and that it got fixed, but I'm experiencing a pain that's different. And so he said, okay, I'll do an ultrasound to see what's going on. He did, and he told me I had fluid buildup in my back. He did injections for me, and the pain went away. And I mentioned this because of the drastic difference between the attitude of the doctors. He didn't dismiss me. He didn't give me trash, nasty facial attitude. He was a doctor. He did the imaging, he did the testing. He saw a problem and he fixed it. End of story. So I cried today. I cried yesterday. I had a horrible morning yesterday as well as today because I have decisions to make. This doctor argued with me for a long time that I don't have a curvature in my spine. I don't have scoliosis, despite the fact that I went to the visit with an x-ray and with an MRI report. So on the MRI report, it says no evidence of scoliosis. When I got that result, I did reach out to the clinic that did the MRI, and I asked them, I've had two previous specialists told me that I have scoliosis, but it's not listed on the MRI report. Why? And they said that the MRI did not um, track for scoliosis. And I told this doctor that. So the report he should have been looking at for the scoliosis was the x-ray. Anyway, he argued with me for a long time. Then in the end, he said, if you want, I can do another x-ray to check for the scoliosis or to evaluate for the scoliosis. Did I need an x-ray done? Just hearing the sound makes me want to laugh. Welcome to my life, yo. No, I don't want to cry. I want to laugh. Did I need an x-ray? I have had two previous specialists told me that I have a curvature, I have scoliosis, and the most recent one included the Cobb angle at 19 degrees. So I got the result of the new doctor's x-ray. Thankfully, the doctor that did the report is not the doctor that I saw. Anyway, I think we can clearly, what's the word I'm looking for? Conclude that he does not know how to read x-rays, because when I look at the x-ray, I see the curve and I feel it in my body too. I think I've already mentioned this earlier, that if I lean, I feel like I'm breaking because of the curve. Yeah, so yeah, I guess I'm losing my train of thought again. That yeah, in the report they noted the curve, but they didn't include the degree of the curve. So I reached out to them and asked that the degree of the curve be included. The other issue is that someone from the doctor's office reached out to me and wanted to schedule me for treatment for tomorrow. And I am thinking, no, I'm not gonna go. I am not going to get treatment from a doctor that I don't have established trust with. Why should I? No, I'm sorry. I'm not a child anymore. I am not the child that used to explain to my adoptive mother that I was in pain and she ignored me. Over the years, I have learned to advocate for myself. I have learned to seek treatment after the pinched nerve that I had, which was caused by a healthcare provider, by the way. I have learned to make better decisions and not to worsen my condition. Now, should I get treatment from a doctor that I don't trust? I don't think so. I don't believe that medical decisions should be one-sided. I live in my body 24/7. I know how I feel, and if I go to a doctor and their first reaction is to dismiss me, ridicule me, and not believe me, no. There are other doctors out there. I will continue the search and I will find someone that I trust. Actually, I would much prefer, sorry, I would much prefer going back to my previous pain management specialist. That man tortured me. Um, Prior to getting the...
Sugar.
Donne-moi. Ouvre-le m'ouvrir. It's completely destroyed, Dudu. I can't do it. Donne-moi. Um, Prior to getting the epidural, I looked at a YouTube video of it, but it did not prepare me for what I went through. It was painful. But procedures are painful. Again, I've been through hell. I suffered a lot with the chronic pain. I suffered a lot when my nerve got entrapped. Um, I was shocked at how painful the epidural was. And honestly, it's not something that I would ever want to do again. I don't know. I would have to be pretty desperate to go through that again. But despite my shock, I survived it all. So, yeah. Um, Again, I guess the doctors are supposed to bring the experience, the education, the medical knowledge, and me as a patient, I bring my lived experience, my symptoms, my fears, my goals, and the knowledge of my body. And any doctor that I am doing treatment with should value those. Otherwise, go to and I'm gonna walk out the door. I guess I should say go to ... Yeah. So I cannot believe it. I didn't think that I would have this kind of experience again. I was hoping to be able to get an impartial doctor that would help guide me into the future, and I did not get that. Yeah, so I think the way to go is to take my time because I'm not willing to make my situation worse. I need to understand the risks, understand the benefits, and make sure that I trust the doctor or person that's helping me, that it's going to make things better. Yeah. Trust isn't automatic, y'all. It's earned. And if you're gonna, I'm not even sure if I can do this for you guys. Let me do it on camera to see if I can actually hone it down. So when I told the doctor that I have scoliosis, his facial expression was Hold on. I'm gonna see if I can do it. Oh gosh, maybe I can't do it. I'm trying to be serious. Come on, guys. You know that dismissive face? Like, is that it? Did I get it? Oh my gosh, I look so terrible. Hold on, let me try again. Oh, maybe this is it. Like, but he did this one with it too. Like, yeah. Yeah, I don't think we can get anywhere with that face. I should be crying, y'all. I should be crying. Yeah, yeah, yeah. This is my life. Welcome to my adoptee life. I could cry, but I have to laugh. Yeah, yeah, yeah. So as I mentioned, I have quite a difficult week ahead. After surviving that pinched nerve, I can survive anything. I can survive just a little bit longer to find a doctor that I trust. I can. Yeah, yeah, yeah. And if you don't believe me, ask any of the people that I've worked out with when my pain was bad. And honestly, I am thinking that I'd much rather go to the gym. I'd much rather run a marathon than go do this treatment tomorrow. Yeah. I think I'm having too much fun with this now. Ugh, I cannot believe. I had hopes. I had hopes. I had hopes. I had hopes that this was gonna go well and that I could find a path forward, but it's okay. Yeah, so if you are someone dealing with medical issues and being gaslit, dismissed, you are not alone. Just take your time. Hopefully, you have that time because I see lots of stories of people that are dismissed and later on they find out that they have stage 4 cancer and um, you know how the story ends. So just try to do the best for yourself. At the end of the day, it's your responsibility to care for yourself. Ask questions, get second opinions, and very important, find doctors that respect you. Yeah. Um, I have so much to say, but I'm just gonna leave it there. Mm-mm-mm. Just take care of yourself. Take care of yourself. Trust yourself And thank you for listening. Thank you so much for listening. Yeah, welcome to my world, welcome to my life, and I will continue sharing this journey, my journey as it unfolds. And for those of you adoptees out there, you can find your voice again. You can heal beyond adoption. I will see you guys in the next one. Bye, bye, bye. If I can find my remote here. See you in the next one. Oh, it didn't work. Bye, y'all.